A good interviewer doesn't care about those things. A good interviewer only cares about Ask Dr. Gray Premed Q&A, sponsored by Blueprint MCAT. How you doing today?
I'm well. How are you, Dr. Gray?
I am great. I'm excited to chat with you, help answer some questions. What can I help you with today?
So I have my interview actually Sunday here. I'm up in Canada. I'm just trying to juggle what I need to highlight in my tell me about yourself and why do you want to be a physician?
Yeah, so this is a very important question. Have you read my interview book?
I have, yes.
Okay. So if you've read my interview book, which you have, and I'm excited, my newest book, the Premed Playbook Guide to the Medical School Application Process, I just got my cover finalized for that. It's going to be blue and green instead of the blue and orange like the interview book. But the goal, as I talk about in the interview book and again in the application process book, is the goal of the interview period is to have a conversation. Where most students go wrong is they focus on selling. They focus on, I need to make sure that this interview understands that I am competent. And by competent, I mean that I am hardworking, that I am good at science, that I like science, that I am compassionate, that I am empathetic, that I am all of these amazing things, right? I'm a good team player, I can communicate. And at the end of the day, the interviewer doesn't care about those things. Let me rephrase that. A good interviewer doesn't care about those things. A good interviewer only cares about who you are, how you communicate, and whether or not they can picture you as being trustworthy enough, compassionate enough through your communication to take care of their loved ones in a hospital. And so with a tell me about yourself question, where what most students do is they will go, well, here's who I am, here's where I went to school, here are the extracurriculars that I've done, and I'm highlighting only the extracurriculars that I think are important to you. I'm highlighting only the extracurriculars that I think will highlight my strengths. And here's my resume. Tell me about yourself, in my mind, is who are you, where are you from, what do you like to do? I'm from this area. I have a brother. I have a sister. I love fly fishing. I love the outdoors. I love running marathons. I love cooking. It humanizes you. Whereas reciting your resume, focusing on your strengths, dehumanizes you. And so everything you do in an interview, you should be doing to humanize yourself, to make yourself a normal human being who can have a conversation and not just a used car salesman.
Mm-hmm.
So that's what you should focus on with tell me about yourself. Who are you? Where are you from? What do you like to do? Because ideally with that humanization process, and I've never really used that language before, the humanization kind of side of things, but I think I like it. And that's why I like answering the same question over and over again, because it forces me to kind of rephrase things, and one of them will catch on and hopefully click for someone. But with that humanization, with your answer, the hope is that the interviewer will go, oh, you're human, I'm a human, let's connect on a human level. You like fly fishing, I love fly fishing. You love cooking, I like eating. What do you like to cook? Maybe you can make it for me, right? Whatever that is. And then all of a sudden, you're just connecting human to human and not used car salesman to car buyer, which is what most students force the interviewer to do.
Mm-hmm.
Does that make sense?
Yeah, that totally makes sense. And I think where I'm kind of struggling, because absolutely that message resonates with me, like humanizing yourself, right? Is that so? I'm a non-trad. I'm a registered nurse, and I work in critical care. So that is, and actually my job, I love my job. I work in helicopter EMS, so
Nice,
hospital and stuff. So that's very much of my identity and who I am, and that's, I wake up and that's what I'm doing, right?
Yeah.
So it's that balance of that is who I am, but still
I,
maintaining
I
that.
wouldn't I wouldn't say that, right? I understand why you're saying that, but it's not who you are, or else you would continue to do that and you wouldn't be applying to medical school.
Fair. Yes.
It's what you do now. You are obviously passionate about healthcare. You are probably a little bit of an adrenaline junkie. Usually, flight EMS people are. They love that
Yeah.
thrill of jumping in the helicopter and landing in these precarious situations and jumping out of the helicopter and loading up a patient. Right there's a
Yeah.
lot of adrenaline that goes along with that. And for some reason, that's not enough for you, and you want kind of totality of care and being able to help your patients, which is why you're going to medical school. And
Mhm.
so it's what you do now. It's not who you are, again, or else you would continue to do that.
Yeah. And I think that's where it comes is the reason I'm pursuing medicine is because I want to do more. I want to learn more and like more skills. I want to crack open chests and things like that, which I can't do right now. Right.
Yep.
So, also with my job, I do community education. So I help teach, like residents, medics, physicians, residents, med students, and we do like pre-hospital stuff and then resuscitation and whatnot.
Yep.
And again, I love that. So I want to go into medicine to increase my capacity to educate and reach more people.
Yeah.
And I don't know if those are things that I should be highlighting in those personal questions or not.
Those should not be highlighted in Tell Me About Yourself, because those are the sales pitch sides of things.
Yeah.
I love to teach. I love being a flight nurse and saving patients, and I'm really good at it, and blah, 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 blah. Right? That kind of stuff isn't necessary. Now, for why physician, then you can go, well, I'm currently a flight nurse, and I've realized that my ability to care for a patient stops. And we land at the hospital, I give sign out, I hand the patient off, and that's all I can do. But I want to be on the receiving end to take that patient and to help stabilize them even further, to help kind of disposition them, help treat them, help care for them, take them to the operating room, whatever it is that you want to do. That is your reason for wanting to be a physician. That has nothing to do with I love being a flight nurse. That just has everything to do with a typical story, whether you're a nurse or a non-healthcare, non-trad, of finding this passion for healthcare and going down the steps of what I talk about, watering your seed, right, in my personal statement book, of figuring out what it is that you want to do for the rest of your life. At some point, you thought that was being a nurse. And then over time, you realized that it wasn't enough for you. And taking that story and finishing the narrative as to why you want to help patients in a different way. Be careful with the I want to do it for me discussion, right? Of like, I want to crack chests. That's for you, but what is the patient receiving from that, right?
Yeah.
You are then helping the patient in different ways that you can't do now as a flight nurse. So focus on the patient when you're talking about that transition and what you can do further with a bigger diploma and more responsibility given to you because of that diploma. Focus on the patient when you're talking about those changes.
Awesome.
What else?
I think in regards, those are the big things that I've been struggling with. I think I've been working around the other, scenario-based questions and things. It's just been that big highlight of what to choose.
Yeah. And I think trying to figure out what to choose is the wrong focus, because that's what the far majority of students are trying to do is, what do I choose? AKA, what should I highlight that positions me in the best light, that shows my strengths, that shows the skills that I have or the traits that I have. And when students focus on those things, they're dehumanizing themselves. Right? Think about going on a date and you're meeting your date at the coffee shop for the first time. You're not sitting outside of that coffee shop going, okay, if they ask this question, I need to focus on this strength. If they ask that question, I need to focus on this specific trait that I have. You're going in and you're having a conversation. That's all you need to do, is go in and have a conversation. Listen to the question, answer the question. Listen to the next question, answer the next question. Where students go wrong is they'll listen to a question, go through their Rolodex of skills and traits and experiences they have and go, okay, based on the AAMC core competencies, I think this is a core competency that I can highlight in this answer. Let me look at all of my experiences that highlight this core competency the best, and let me give that answer. Right? That's not a conversation.
Yeah, totally. And I think that's where I'm a little worried that, if I just kind of tell my story, and again, I know they're competent because they are doing med school interviews, is that they're going to be able to extrapolate those things from what I'm telling them. And I think that's just where I get a little bit anxious about not saying that my experience, this is why it's good, right? But I totally understand that is a better way to approach it.
Yeah, I 1,000% recommend not trying to connect everything you're saying to being a physician.
Okay.
Students will give an experience and go, and this will help me be a physician because. Unless the interviewer specifically asks, tell me about a time when, and tell me why you think that's going to help you as a physician, don't add that in.
Okay, awesome.
That's their job to extrapolate that if they want to. But remember, again, the far majority of interviewers don't care about that. They care about, are you a human being who I would want taking care of my loved one in a hospital? Mm-hmm. Medical school will teach you everything you need to know about being a physician. Residency will teach you that. You don't need to come in saying that you already have the experiences that show you're going to be a great physician.
Awesome.
Let's talk about your MCAT prep. You used Blueprint MCAT. How did that go for you?
I did. It was really good. So I finished my nursing degree in 2012. And in my program, there wasn't any like those science classes. I took an anatomy and physiology class, right? So that was it. That was my extent of university level science.
Yep.
And then being out of school for almost 9 years, I went in to prep for it and thought this will be easy, 3-4 months. Realized it was not easy. So I decided to sign up. Yeah, I used Blueprint. Just from watching your videos and stuff and just like forums, it was highly recommended. So I did it. So I did the 6 month, and I did, considering I didn't have any pre-med classes. So I went from relatively novice in all of those areas, and I actually got a decent MCAT mark, not blew it out of the water or anything like that. But considering my background, I felt like it was awesome. It was a great experience.